Sunita Agarwal, chairperson of Agarwal Hospital, a pioneer in medical innovation and a passionate advocate for women's health and well-being. Let's give a warm welcome to the visionary Dr. Sunita Agarwal.
Namaskara. I am Dr. Sunita Agarwal and I come from a family of doctors. So we have it for more than 100 years. My grandfather, my parents, my brother, me, and now my 4 sons. We have 200 institutions world over. But what I'd like to do today, starting first, is I'm going to play a video. Lavanya has already told me 15 minutes flat, so that video is 15 minutes. It's already going to be on YouTube. You can keep watching that, and I'm going to talk to you. Whatever comes on the video is fine, okay? But first, I need to thank Om Namah Shivaya. I'm just coming back from Tiruvannamalai, and I'm going to ask Bhuvna, my very, very favorite prodigy, and she's going to bring you the laddu from Tiruvannamalai Mandir, whatever, Prashad. Yeah? So first thank you is there. Second thank you is to my patients, each and every one of them, who have taught me so much, and not just my patients, also my parents and also their parents, because this cannot come in one generation. It has to have flowed with many generations, and this would have come only when there was a need for it, that strong, that somebody else wanted it, that powerful. So my patients are my next thank you to, and then my family, my husband, and I'd like to first thank Neha Bagaria and her wonderful team of Lavanya and Shreya and everybody for giving us this platform. It has always been very, very enterprising and very, very nice for me to talk to an all-female group. It never happens, just like how my earlier speaker just now told you, it's a very male-dominated society, and that's true as well as in medicine. This is what you're seeing is when manna and plasma are added, we form DNA. That DNA belongs to the same patient from where the plasma came. This happens within 1 second. Now, of course, you're going to say this is something out of a science fiction movie, and very true, it so appears to be. That little cannula that you're seeing that is picking up the DNA is only 5 microns wide. So we pick up the DNA and then we place it back into the patient. We give it back as injections to the patient. All this is jargon, you can always read it. It's going to be on YouTube. You can go through it if you really like it. But what I'm going to tell you is, how did I get there? It's like I just told you, it's not a flash in the pan. We have worked and worked and worked for getting us into that position. Number one are my ancestors. Because I can assure you, a doctor who goes through 15 years of education and then another 15, 20 years of getting into the practice does not feel like telling the patient, go home and die, or go home and go blind. Does not. So I can appreciate that that was what the situation was that my parents or my grandparents or my people ahead of them and all the doctors of this world would have wanted. Then now when I'm coming back to that realization, I'm understanding that the fetal DNA is the one DNA that can help treat the patient. Worst case scenarios for us are congenital errors. Congenital errors, you can't see your baby cry. Whatever you do, you want to see a healthy baby. Doesn't happen, there is a problem. We cannot cure, but yes, we can treat that patient. We can make that person a little better. And isn't that all that you go to a doctor for? So when we did this study, I operated on that patient, who was completely blind. We picked up the DNA, and all of my medical career, we are told, don't touch the optic nerve, don't touch any nerve, ulnar nerve, any nerve. Here, I'm going right into the optic nerve of a completely blind patient. That means he cannot even see light. So we first cleared up his eye, there was blood, a lot of other things. Cleared his eye, that means we did a vitrectomy. And now we're going right into the optic nerve. Right into the optic nerve. The optic nerve is only 1.5 millimeters wide. So we have to be very, very precise, and we have to pick up only that much of DNA. In this itself, the patient immediately told me, as soon as I finished it, I can see the operating microscope light. So we already knew. Thank you so much. We already knew we are onto something very big. It took me about 2 years and over 2,000 patients for all of us, my whole team, to understand that this is not enough for a small person in a small city like Bangalore and whatever, to do this on my own. So we took an appointment with Dr. Abdul Kalam. This is how cells will look when they are inside, when you're looking at it under a microscope. But when you add manna to it, they all take a nice round shape, and that is what we call as manna cells. Now you're seeing a black ball coming out of the interface where manna meets the blood. This was a cancer patient. This black ball you can see is spewing cells. Now each one of those cells are that own patient's adult stem cells. Now this stem cell is not coming from anywhere else. It's coming from him. That's why it has a far more bigger advantage. And that's why we're able to prove within 10 days, yes, we can make a difference to that patient. Yes, he has cancer. We're not talking about life and death, but we're definitely talking about the quality of life. Because the first thing the cancer patient has is a lot of pain. That is something we can try and remove. So we took all this and went to meet Dr. Abdul Kalam. This happened in 2006. At that time, there was no LED. He had a huge plasma screen in his office in the Rashtrapati Bhavan. You can't take even a mobile phone. We carried a whole microscope because we are dealing with the scientist after all. So we went there and we requested him. We took out the plug from the plasma screen, hooked it up to our microscope, and we showed him that manna effect. Now these are the kind of patients that you want to do and you think you can do something, then let's do it. There's one patient, I don't know if I'm going to be able to show you that video, but actually that man was not able to walk. And for 1 month, we had been treating him with manna. After 1 month, he walked from there to there, and everybody in our office was crying. This is not one story, two story. We have finished more than 18,000 patients in the last 20 years. Not one side effect, not one complication, not one allergic reaction. If I have to give even lidocaine, which is an aesthetic material, then also I will have 1 in 1,500 allergic reaction. I'll have 1 in 10,000 dead. Okay. Here, we've already given more than 20,000 patients. Each patient gets at least 10 injections, like I explained to you. For that, not one side effect, not one allergy. But here we have only one big situation. We need the patient to understand, we're taking you back to your field stage. What do you want to do? Eat and sleep. So we need to make sure that the sugar of the patient is above 100. With every injection, we are going to drop the sugar by 40 counts. That's another guy with foot drop. And when he was running, everybody gets so excited because these are children who can't walk. And their enthusiasm reflects back on all of us and also makes us feel like doing more. I don't know if in this, I have about 5 minutes left. I don't know if in this little about time I've been able to explain to you what I've been trying to do, but this is morphogenetic activator of nucleic acids. That means it is akin to life. Now, if it comes into contact with your plasma, in the plasma there will be DNA, it will take your DNA to the fetal stage. There will be cells, it will take the cells to the fetal stem cell area. But we don't call them fetal stem cells, now they're called adult stem cells. We've done enough investigations and scientific validations because after Dr. Abdul Kalam, his meeting with me was 45 minutes. It was actually scheduled for 5 minutes. After that, he told me, and because he's from Chennai, and I'm also from Chennai, originally, he spoke to me in Tamil. So he said, don't give it to me, but I'm going to ask you to do 3 things. Open a corporation, get your drug control ready, get your patent ready. I said, I'm not made for all this, I don't know how to do all this. I will do what I can. I said, but this is the guy. Everybody, and you can see he put a tissue in his mouth because he's got drooling as well. So there's a lot of, not one complication, but a lot of other complications as well. But he was walking on his own. So he told me, and he brought in the DRDO, because in the Rashtrapati Bhavan, the DRDO just came in. He says, now you talk to her, and you go with these guys, they will do everything you want. Everybody in the DRDO, all the data, they have 52 labs. And believe me, I'm not a government official. I've got nothing to do with anything in the defense or any other such way. Yet, I was allowed access to all the 52 labs all over the country. And when they have a directors meeting where these 52 into 2, 110 people are there, me and my husband were the only people outside allowed in. Just कहते परिंदा भी नहीं जा सकता. There we were allowed to go. It's exciting when you're doing things with the government of India and with their blessings. That's when we understand that this is called morphogenetic activator of nucleic acids. And then we went to Indian Institute of Sciences and Max Planck has got a commercial outfit called Eurofins. So we went to all these other organizations. In the meantime, we were still continuing with our research as well. That's why we have reached close to 20,000 patients already. I have only 3 minutes left. Please ask me your questions. Yes. Yes. Very good point. It depends on what stage we're coming to. I can tell you one example that I had. There was a patient where it came out in the Times of India in Bangalore about 10-15 years ago, and he had some 3-4 sisters, and he was practically dying. He was on the bed, not able to talk, walk, anything. So I rang up the resident editor because I knew him. I said, Balram sir, what is this? Who is this guy who's going to die? Maybe we can do something about it. So he said, okay, you want to try and do something? I said, yeah, send him over. So he sent him over. 10 days later, of course, this guy came in a bed and all that. 10 days over, he's standing with me, and he's talking and walking and standing right there. Madam, actually what happened? I said, are you okay? Yes, madam, I am perfectly alright. What happened? I was sleeping north-south. Now I am sleeping east-west. I am not eating ragi ball. Now I am eating ragi. I said, very good, sir. You continue that, don't come here again. Poor guy, he started crying there itself. So I think I answered that question of yours as well. Yes, ma'am. Mike. Pehle, who are you?
I'm Sharada.
Because I've been watching both of you, all three of you, very, very nice mechanisms that you were actually hearing the whole talk.
So, does it work for all genetic disorders or is it only the...
I only said genetic disorders. I'm saying it works for just about anything where you want to treat it with fetal DNA. And that patient's own fetal DNA. See, why fetal DNA? Because in 9 months, you are born complete with everything made. You didn't come out and then found that, oh, I should grow my little finger. It's not possible. Everything happened inside the womb. So, what that tells us is that the fetal DNA has got a 100% propensity. It can make everything. Now we're going to reintroduce that patient to that same fetal DNA. Only we're using only 0.1 ml of manna. And we're taking only 1 drop of the patient's blood from the finger. So the amount is very less. We can't put an overdose, that's why. I just want to show you, I'm already on manna. I'm a swimmer. So right from 74, I've been on Team India, Olympics for 76. Can you see there's a banding on that? So I'm a Mana, and I'm going to win the gold medal at one point or the other. Thanks to Mana. It's a dream for 50 years. Why did I show you this? There are so many doctors all over the world who will come back and told me already. So many of my esteemed professors, I will come back and ask him, we do a lot of surgeries for removing glass power. So this nice big professor is on the dais with mota chashma. So after the talk, I went back and asked him, how come you didn't do this on yourself? Huh? I'm an eye surgeon. I can do this. Really? You're the eye surgeon. What about the rest of your patients? So I want to show you this. This is how I can show you that this is my quality control. First me, every batch that we make. First me, my husband, or whoever's the team that's made it, and then it goes to the patient. Did I answer your question? Yes, anybody? Time out. Yes, they are.
That was a wet ma'am. Thank you so much for that informative session. Let's give a round of applause, please. Thank you so much for enlightening us. Your expertise and passion for advancing health is really inspiring. Thank you so much. Thank you. Moving ahead to our next session, there's this one symbol that arrives or that comes up